This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week I am coming to you on location. I am at the Barrow Neurological Institute in Phoenix at Phoenix Children's Hospital. My guest is Dr. Robin Blitz. She is the Section Chief and Director of Developmental Pediatrics here. She's also a Clinical Associate Professor at the University of Arizona College of Medicine. Dr. Blitz, welcome.
Thank you. It's nice to be here.
Thank you. It's nice to be here, too. I love to take the show on the road and talk to someone outside of our system. You know, we usually talk with a lot of the providers up in the tri-state area, and it's nice to come down and speak with an expert in the field.
Well, I'm glad that you came, and I'm especially glad that your wife is here joining us today for our training.
Thank you. So my wife, Dr. Leanna LaFredo, is here taking this course that is called Early Access to Care, and it's all about teaching providers to be able to diagnose autism, right?
Mm-hmm. Well, not only to diagnose autism, but also to provide medical home care for children with autism, partnering with the early intervention and school personnel in their regions to provide earlier access to diagnosis and earlier access to interventions.
And I think this is such interesting subject matter. We hear a lot about autism in the news and in the media, and we'll get into that in a little bit. I think, a good place to start with is we hear about autism, and I think a lot of us have like a general idea of what that is, but it's really maybe broader than that. We talk about the autism spectrum disorder.
Well, in 2013, the Diagnostic Statistical Manual, DSM, published the 5th edition, DSM-5, and changed the terminology. Prior to that, there was autism, there was pervasive developmental disorder not otherwise specified, and there was Asperger's syndrome, along with childhood disintegrative disorder and Rett syndrome, all under the pervasive developmental disorders. But under DSM-5, the autism spectrum disorder diagnosis encompasses PDD, NOS, classic autism, Asperger's syndrome.
Got it. So if we may mention ASD along the way in this
Right.
interview, that is autism spectrum disorder, which really is a variety of...
Right. It's a broader term to help us understand that people with autism have a range of abilities intellectually. So some people with autism have intellectual disability, while other people with autism can have a genius IQ. Some people with autism are completely nonverbal, while other people with autism are hyperverbal, but may not always use communication for appropriate social intent. Some people with autism have motor stereotypies, such as hand flapping and self-spinning, while other people with autism don't have that at all. So it really helps us understand, just like many developmental and behavioral disorders and differences, is that there's a range of people. And a lot of us in the field like to say, if you've met one person with autism, you've met one person with autism. Right? We all have our differences.
Yeah. That's well said. I've never heard that phrase before. That's well said. What is the earliest we can diagnose a person with autism?
Well, there's definitely research going on right now, and there are some tools that are beginning to be available to look at children as young as 12 months old. Certainly children who are severely language delayed can also have self-stimulatory behaviors and repetitive behaviors, poor social skills, poor social intent. Right now, the average age of diagnosis in Arizona is 4 years, 7 months of age. Our goal with this program is to get the age of diagnosis under 2.5 years of age. We're really, one of the tools that the pediatricians are being trained on right now, the STAT, can go down as young as 14 months of age. So we would like to bring not only the age of diagnosis significantly down, but also we'd like to decrease that lag time from the age of parent concern to the age of evaluation and diagnosis. Right. And certainly there are lots of things that need to be rolled out when a child's language delayed or socially delayed. You need to make sure the child's hearing and seeing appropriately. Because if a child's not hearing or seeing appropriately, that can impact their language and their social skills. And we need to make sure that the child isn't having other health problems like seizures that could be causing problems. So one of the things that we do in this 6-month learning collaborative is train our pediatricians not only how to diagnose autism, but also how to look for and recognize other developmental disabilities.
And what is the importance of having that diagnosis?
Well, the importance of having any diagnosis, right? I know I come from a medical model, and so our medical model is that in order to provide treatment, a treatment plan, we have to have a diagnosis, right?
Right, sure.
And I think that's in a lot of fields, like the car mechanic wants to know, I guess, if it's your carburetor or your wheel alignment before they fix something.
Seems
they have to
significant,
figure it
yeah,
out.
right.
So, one of the purposes of diagnosis is to make sure that we develop an appropriate treatment plan to help that child get better, also to help the family function better. When a parent doesn't know, okay, my child's 2 and my sister's 2-year-old is talking and interacting with other children and adults and having pretend play and playing next to other children, but my child's not doing any of that. Sometimes the parents feel like they're doing something wrong, when in fact, if we can help identify what is hindering that child from developing appropriately, we can help the child with early intervention. We can also help the family with education and support.
It's obvious that early intervention is critical. So what are the barriers to getting kids the care they need?
Well, in Arizona specifically, we don't have a lot of people trained to diagnose autism. And in Arizona, our state's provider for autism therapy is called the Division of Developmental Disabilities. Now, also our schools can provide educational services when a child's 3 years old and older. Our AZIP, our Arizona Early Intervention Program, provides interventions to children under the age of 3. We now have Stevens Law, so some private insurances are required to pay for medically necessary autism therapies. Our access plans, which is our state Medicaid, is there and should be able to provide medically necessary therapies also. And I say should because we don't really have the capacity, not only for diagnosis, but also for intervention. So I'm going to backtrack a little.
Okay.
DDD, our state Division of Developmental Disabilities, is legislated to provide interventions for children with epilepsy, autism, intellectual disability, or cerebral palsy. So unless you have one of those 4 diagnoses, you don't get DDD services. Now, that doesn't mean you can't get services, but DDD is our state agency to provide those therapies. The only people that's legislated, that's allowed to make this diagnosis, when I first came to Arizona in 1996, were child psychiatrists and licensed psychologists.
Okay.
So it took 8 years after I got here, and I was the 3rd developmental pediatrician to arrive in the state of Arizona in 1996, but it took 8 years to get it on the books that my diagnosis as a developmental pediatrician was approved.
Really?
And I came to Arizona saying, wait, this is what I'm trained in. What do you mean I can't diagnose? So because it's legislated in this state,
right.
It took 8 years. And just recently, the policy was updated to include child neurologists. So that's a barrier to diagnosis.
Legislative sludge, isn't
yes,
it?
but I want to be clear that this is not true for our access plans. So our access plans were always accepting my diagnosis and child neurologist diagnoses, and our private insurance. Now TRICARE, which is a big insurer in this state, this policy is that a primary care provider like a pediatrician or a family practice doc can diagnose autism as long as it's backed up by the ADOS, the Autism Diagnostic Observation Scale. So part of Early Access to Care Arizona, we call it EACAZ for our little acronym.
Uh-huh.
Part of that is that not only are we training the pediatricians, but we're also, and family practice doc, we have a family practice doc this cohort, but we're also training nurses, nurse practitioners, PAs, early intervention people, and school people to do the ADOS, to back up that diagnosis made by the pediatrician or primary care provider. So we're trying to model off of TRICARE. as far as what they'll accept for diagnosis. And then it, in fact, gives a multidisciplinary diagnosis. At least you have 2 different disciplines looking at this child who agree on the diagnosis. And if they disagree, then I'll see them, right, as an in-person or telemedicine consult. The other piece is that, yes, in the metropolitan areas, we have treatment plans. We have schools. We have people that do ABA and other autism-specific therapies like floor time. But if you go outside of the metropolitan areas, that's hard to find. So one of the things I'm working on right now, and if any of your listeners have any great funding sources, love to hear from them, because I would really like to have a statewide system using telemedicine to have the autism therapist coaching the parents to do parent-mediated intervention or daycare-mediated intervention. And there's some good literature out there that supports the efficacy of parent-mediated intervention, that it has the same benefits to helping with problem behaviors in children with autism and helping with social communication that a therapist working with the child does. And so if we can use a therapist to coach the parents via telemedicine, we can reach out into those far out rural areas of Arizona, like Kingman, to provide more intensive services. And so that more children can get these therapies. And in fact, I've had talks with some of the Indian health facilities of, could we use their clinic on a Saturday? Because a lot of people in rural Arizona don't have broadband, even though I heard yesterday that might be changing, but don't have broadband. So could they come to your clinic to have the therapist on the television screen work with 3 or 4 or 5 or 6 families at a time to provide that coaching?
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Dr. Robin Blitz. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. KRMC is pleased to announce that Dr. Justin Garrison has become a permanent member of KRMC Primary Care. As a family practitioner, Dr. Garrison provides comprehensive health care for male and female patients of all ages. To schedule an appointment, call 681-8530. KRMC. And welcome back to Focus on Your Health. I'm TG LaFredo, and this week I'm coming to you from the Barrow Neurological Institute at Phoenix Children's Hospital. My guest is Dr. Robin Blitz. She's the Section Chief and Director of Developmental Pediatrics. We're talking all about autism spectrum disorder. According to the CDC, 1 in 68 children has been identified with autism spectrum disorder. Mm-hmm. And we've, as I was saying, we've heard a lot about how those numbers have been on the increase over the years. Are more kids, do more kids have autism today? Are we just doing a better diagnosis? Is it some combination of both? What do you think of all that?
Well, and in fact, Arizona is, you told me not to move.
No, you're
Arizona,
fine.
has been taking part in the CDC's project. It's the Arizona Developmental Disabilities Surveillance Program. And in Arizona, it's 1 in 66. So 1 in 42 boys. So I have several answers to that. When I was starting out, the recurrence risk in siblings was thought to be 1 to 3%. So if you have another child, you had a 1 to 3% risk of having another child with autism. And now we know it's 18.7%.
Wow, okay.
We also know that on our chromosomal microarrays, on some of them, we're finding up to 30% of children with autism have a specific duplication or deletion syndrome. So they either have too much genetic material in one place or too little genetic material in another place. We know that things like Fragile X syndrome and other X-linked chromosomal abnormalities lead to global developmental delays, intellectual disability, and autism. And so we know that there is a genetic abnormality that And as we get more and more and more intelligent in understanding genetics, we'll find that there's some genetic reason for a lot of our difficulties. And then it's very likely that possibly something in the prenatal environment before the child's born sets off a cascade of events that sets off autism. We do know that older paternal age, not mothers, first-time mothers aren't blamed for this, but older fathers have a higher likelihood of having a child with autism. And think about what was happening 30 or 40 years ago. We didn't have the same level of divorce, the same rate of divorce. We didn't have people having so many second families. We have more of that now.
Yeah.
And we have fathers who are getting married again, oftentimes to younger women who have second families. And so, that increases risks. I will tell you that when I was 20, 21, 22, 23, my summers were spent working at a camp for girls with mental retardation. It was a 6-week overnight camp. And by the way, now we call it intellectual disability. President Obama signed Roso's law, in Roso's bill into Roso's law in 2010, which changed federal terminology because of the negative connotation behind mental retardation. So intellectual disability. And there were 20 girls at this sleepover 6-week camp. And we were teaching life skills and also having fun. And I was a college student and then a medical student. And knowing what I know now, I know that 2 of those 20 girls who were classified as having mental retardation clearly had autism. One little girl in particular, and I can picture her and I know her name and I remember her fondly because she was assigned to me, and she had all the self-stimulatory behaviors. She was completely nonverbal, but she was smart as a whip with regards to taking care of other things, many other things in camp. She could figure out things visually and mechanically. None of the other girls could do that. But she was completely nonverbal and had a lot of self-stimulatory behavior. I am sure she had autism. We just didn't identify it then.
Right.
My sister had intellectual disabilities and epilepsy. And in her class, her self-contained special education class, I can tell you there were a couple kids who now would be we would say they have autism. So I think we're identifying better. I also don't argue that there are some environmental something that goes on. There are people that, hypothesize about environmental toxins, and it's likely that it's very possible that environmental toxin sets off a cascade of events for that child who is predisposed to having autism because of that genetic abnormality.
Gotcha. Well, you've led me into one of my favorite, I'm going to put on my seatbelt for this, but one of my favorite things to talk about, which is, we've heard an awful lot made of the connection, between the MMR vaccine and autism spectrum disorder. Mm-hmm. Can you say a little something about that? I can step out for a minute.
As I take a deep breath.
I'll just leave the microphone set up and I can...
So we know that all started with an article from the Lancet Journal in England.
Right.
We know that the person who, I don't really want to mention his name because I don't want to give him any more fame than he already has. He falsified data and his paper was pulled from the Lancet. The other authors stepped away from it and rescinded their names off the article. It was not true. And unfortunately, that set off a wave of people not wanting to vaccinate their children, which has increased the risk of the rate of measles and other infectious diseases. And I'm old enough to remember when I was a resident that I had patients dying from diphtheria. I had a patient die from measles, a little infant. I had a patient who ended up having varicella, chickenpox, encephalopathy, and so the child became blind and hearing impaired and intellectually disabled. I knew people when I was growing up who had polio and who were in wheelchairs or had braces and couldn't walk. And we could eradicate those diseases. But now we have a wave of people who are not receiving vaccines. I will tell you that I even have a family, both boys have autism. The oldest boy, the mother blamed the vaccines on the child's autism. Then she had a second child, a boy. Now, she would not do genetic testing. And she had a second child, a boy, who she refused to vaccinate. And that child has autism too.
Right.
And she still believes it's the vaccines that she got that caused this child's autism. It's just not true. And we have to look at things scientifically. And if we don't study things scientifically, then it's just all Alice in Wonderland. I mean, it's the same with thimerosal. You know, thimerosal is a preservative that allows us to store multiple vaccines instead of having individual allotments. And because of the scare, because thimerosal is made from ethyl mercury, not methyl mercury, so it's inorganic mercury, not organic mercury. Off the coast of Japan, there was a methyl mercury poisoning that caused pregnant women to have children with severe physical and neurological defects, and infants developed intellectual disability and seizures, and those kids were severely affected. Ethyl mercury, on the other hand, clears the body within something like 2 to 6 hours. I can't be quoted exactly on that, and is not a neurotoxin. And that's was in thimerosal. And in fact, a Scandinavian country, they register everybody, right? So they tested the prevalence of autism before thimerosal was removed and after thimerosal was removed. There was no difference in the prevalence of autism. But what it did do was it increased the cost of vaccines, especially to our UNICEF nations, by millions, and our World Health Organization nations. And so, unfortunately, when people start believing myths, our children get sicker, our children don't have access to vaccines across the world, and people still have autism.
Okay.
Sorry, I got on my soapbox.
No, don't be sorry. That's why you're here. I love it. Don't be sorry. And I know we're just about out of time, but there's something else I have to ask you, and I have to preface it by saying I am loath to bring it up because honestly, there's too much politics and there's too much religion on the radio, and you can quote me on that. Mm-hmm. But I have to wonder, all of this that you're discussing is so much in the news right now. And with the new administration coming in, I wrote down this tweet, and I'd just like to read it to you. And this is from our president. And he said, "Healthy young child goes to doctor, gets pumped with massive shot of many vaccines, doesn't feel good and changes. Autism," and that's all in capital letters. "Many such cases!" ! I'm wondering what someone with your level of expertise, I mean, you're up against, now I'm venturing into editorial. I don't want to do that. You're an expert in this field. You're up against a reality TV star. And I'm wondering, I mean, is science under attack?
Well, I think science is under attack, and it's not just with regards to immunizations and healthcare. It's with regards to our environment, and it's just a very scary time in which we live when people make statements that are just not based in fact.
What do you do?
We keep on trying to educate the public and educate our families, and on a one-by-one basis, and keep on trying to get the public health message out there that pediatricians and family practice docs, the American Academy of Pediatrics, the American Academy of Family Medicine, we're here to help our patients, our children, be healthier and be safer. None of us get kickbacks from immunizations. None of us have stock in these companies that create immunizations. Most pediatricians and family practice docs are some of the lower paid physicians there are in the country. And so all of us are doing this because we want to help kids be healthier. We want to take care of our children and families and our communities. And so I think it's very scary when people in power make these statements. You know, we have a national organization, governmental organization for vaccine adverse events where we are required to report, and we do report. And have there been kids who have gotten some immunizations, who have had fevers afterwards, or who have had health problems? Yes, but is that common? No. And my understanding of the literature and what I read is that those cases, those children had underlying metabolic problems, inborn errors of metabolism, mitochondrial disorders, other health problems that set off a cascade of events. Did my children get immunized? Absolutely. Will my grandchildren get immunized? Absolutely. And do I question new things that come up? Absolutely. And so I encourage all of my families and of the parents of the children that I take care of, if there's a complementary or alternative herb or supplement or something out there that you want to give your child, because all of us want our children to be healthy and happy and perfect and developmentally normal and typical. When you hear the diagnosis of autism, it's a scary diagnosis. And so as a pediatrician, as a developmental pediatrician, I want to make sure that my parents know that I am a partner with them in their child's health. And I want them to tell me anything extra that they want to start their child on, or that they've already started their child on, because that can affect my treatment. But also I can help educate the family on whether this is safe or not safe. And I can help guide and investigate. And I'm the first person to say I don't know everything, so I will look into it for you. And we are trained to look at things with a critical eye. I mean, I don't know that everybody understands, but I didn't get done with my training until I was 32. I yell at my mother sometimes because she put me in preschool at 3. So I was in school for 29 years, but I, cut out preschool. I graduated high school. I did 4 years of college. I did 4 years of medical school. I did 3 years of residency. I did 3 years of fellowship. The majority of my life has been spent studying, and we continue to study. It's a requirement to keep our license that we continue to study, and we continue to do quality improvement projects. It's a requirement. It is what I love to do. I want to do everything I can to help my patients and their families be healthier and happier. And so we stay up on the literature so that we can do that and be effective care providers. I just hope that the people in power start coming around to what facts are and science and truth. So, and I hope I don't get myself in trouble.
That's Dr. Robin Blitz. She is the Section Chief and Director of Developmental Pediatrics at the Barrow Neurological Institute at Phoenix Children's Hospital. She's also a Clinical Associate Professor for the University of Arizona College of Medicine. Dr. Blitz, thank you so much.
My pleasure. It's been fun. Love to do it again.
Let's do it again.
Stand up. Don't give up the fight.
And that's the show. I'm TG LaFredo. Thanks so much for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next time.
So now you see the light. Hey, stand up for your right. Come on, get up, stand up. Stand up for your right. Get up, stand up. Don't give up the fight.
Do you need an inhaler?
I'm in a good place if I have a problem. I know that much.